What is the right time to hire staff for your medical practice? This is a hard decision, and there are many factors at play. But in this video, I'm going to break down what I have seen to work well for other successful medical entrepreneurs when it comes to staffing their practices. Hi, I'm Dr. Annie DePasquale, the founder of Collaborating Docs. We help NPs and PAs get connected to fabulous collaborating physicians. Today's all about hiring. So picture it now. You're starting your own medical practice and it's brick and mortar. You're going to be doing primary care and you are overjoyed that you found your office location. It has a beautiful entryway that a medical receptionist could sit at. And in the back, there's a separate private office for your practice manager. There's a lovely nurses station for your MAs, your nurses. And you think it would be a great idea to hire all those positions before the first patient sets foot on the property. My word of caution is I've seen this play out many times before. And it is best to be a bit conservative on hiring until you have proven that you have good patient flow, you have a busy, bustling practice, and you need the help. At first, you absolutely want to be a jack of all trades, a Jill of all trades, and do everything. So you're the entrepreneur, it's your practice, so you pick up the phone when it rings. You email people back when they have inquiries. You do the vital signs, you do the phlebotomy, you check people out and set up their next appointment. You get to do it all. Now, obviously, some of these tasks you may feel are beneath you, and they are. As you grow, there will be no need for you to do every job in the shop. But it is a very good idea to have a good understanding of what all those roles involve. So when you're hiring, you know, oh, I know exactly what this person needs to do because I've been doing it. And you can give them a very clear guideline on how you want things done, how they need to be professional about certain things. Like if you've done it yourself, you will be the best at training the next person to do it. And it's your practice, so you're setting the high standard that then everyone else is going to have to follow and emulate. So absolutely, there's no need to hire until you yourself are maxed out, which is a wonderful problem. That means you're very busy and you can't possibly do all the things yourself. So the nice answer to this question is you will know it. It will hit you in the face that you absolutely need to hire someone. So if you're not at that place yet, that means you don't need help. Absolutely no. If you have time in the day to still pick up the phone, you do not need to hire a receptionist. So overall, I'm giving a rather conservative suggestion. There are some intermediate things that if you feel like you must have someone by your side, I highly recommend getting a nurse practitioner student, a PA student, a medical student, nursing student. You can show them the way, and in turn, they can help you out in certain ways. Obviously, you can only allow them to do things they legally can do, but answering the phone, anyone can do. And so there's certain things that, you show them how to do an interesting medical procedure, their interest level stays high, and then they're willing to do other things to help you out. So sort of like an internship situation or precepting situation is a wonderful way to go. Another option would be to hire someone very, 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 very part-time to maybe just take a few hours off of your plate so you can maybe do very focused patient care from 10 to 2 and not be bothered by the ringing phone or checking people out as you're getting your clinical care done, your notes done. So good people to consider, like semi-retired folks or college students, people that maybe are looking for flexible work, aren't expecting the highest salary in the world. Friends and family, sometimes I've seen work very well. I've seen a lot of husband and wife practices. One of them kind of runs the office, the practice, the other is the medical provider. So you can get creative with people, but I definitely have more frequently seen people over bloated with staff in every direction that honestly don't even have enough work to keep them busy, but you still are stuck paying them a salary. So it's an exciting time if this is a question that you're dealing with, but the good news is in your heart of hearts, in your gut, you will know, okay, now I've hit the moment where I could absolutely use position XYZ. I'm going to pull the trigger and get that person in. Also, hybrid roles can be very beneficial. So someone that can answer the phone and do vitals. So you're sort of covering both bases. Then when you're busy enough, you could split it up to a receptionist and an MA. So I hope some of these ideas are percolating and some work for you. I'm very excited for you starting your practice. And if you need a collaborator, we are here to help.